Osteogenesis Imperfecta, OI by Christy Tran. Osteogenesis imperfecta means imperfect bone formation. It is also known as brittle bone disease. This is due to the condition of the bones. OI is a genetic disorder that affects the bones, which causes the bones to break easily either through a mild trauma or through everyday motion. Those diagnosed with OI have an abnormal production of collagen. This hinders their body's abilities to make strong bones. Osteogenesis imperfecta occurs equally among females and males and among ethnic groups. It is estimated to affect 25,000 to 50,000 individuals in the United States. If OI is diagnosed in a patient either before or shortly after birth, it can become a life-threatening disease. The symptoms of OI vary depending on the type of disease. Those who have OI all have fragile bones, but the severity differs from person to person. Symptoms of OI include bone deformities, early hearing loss, bowed legs and arms, and this is usually from multiple fractures, blue sclera, which is the appearance of a bluish color in the white of the eye, kyphosis, or the abnormal outward curve of the upper spine, scoliosis, which is the abnormal lateral curve of the spine, and respiratory problems. A physician will be able to diagnose OI by taking x-rays, lab tests, or a skin punch biopsy. An x-ray allows the doctor to see broken bones that are new and old. Lab tests can be used to analyze the structure of the collagen, and a skin punch biopsy is used to analyze skin tissue. OI can be inherited from a parent, be caused by genetic mutation, or due to change. Collagen is a structural protein material used for bones, skin, cartilage, and ligaments. It is part of the framework that bones are formed around. Dominant OI is due to mutations in genes COL1A1 or COL1A2. Recessive OI is due to mutations in CTRAP or LEPRE1 genes that interfere with collagen production. There are 8 types of OI. The majority of cases are diagnosed either under type 1 to type 4. Type 1 to type 4 OI is due to a dominant gene mutation when coding for type 1 collagen. Type 5 and type 6 do not have a type 1 collagen mutation, but the genes causing them have not yet been identified. Type 7 and type 8 are newly identified forms which are inherited in a recessive manner. Type 1 is the most common and the mildest of all types. Most fractures occur before puberty. Type 1 has a normal to near normal posture with loose joints and some muscle weakness. Their collagen structure is normal, but they have less collagen. Type 2 is the most severe form of OI. Those with type 2 frequently die at birth or shortly after due to respiratory problems. They have numerous fractures and severe bone deformities. They have a small stature and improperly formed collagen. Type 3 OI is the most severe type for those who survive the neonatal period. Their bones fracture easily and are usually present at birth. They have a small stature and severe bone deformities. They also have improperly formed collagen. Type 4 OI is between type 1 and 3 in severity. Their bones are easily fractured, often occurring before puberty. They have a smaller than average stature and mild to moderate bone deformities. Type 5 is clinically similar to type 4 in appearance and symptoms. They have hypertrophic calluses, which is unusually large calluses at the site of the fractures. Type 6 is similar to type 4 as well. Their bones have a distinctive fish scale appearance when viewed under a microscope. Type 7 is similar to type 2 in appearance and symptoms. They have a short humerus and short femur. Type 8 is similar to type 2 and 3 in appearance and symptoms, except that infants have white sclera. They have a severe growth deficiency and their bones are undermineralized. A cure has not been found for osteogenesis imperfecta. However, there are supportive therapies that focus on preventing and controlling the symptoms. Physical and occupational therapy help increase motility and muscle strength. Low-impact exercise helps build bones. A surgical procedure called rodding helps strengthen bones and prevents deformities by inserting metal rods through the length of the long bones. Medication is also a consideration to help reduce pain. By following these treatments, it will help reduce the risk of broken bones and increase the quality of life.